We're here with Andrew Triska from andrewtriska.wordpress.com. And Andrew, I'm Kathy Bartoli from the intimacydojo.com. Andrew, you're going to be talking about reshaping the language of sexuality and intellectual disabilities in clinical practice and beyond at Woodhull's Sexual Freedom Summit this August in a couple months. And I think that's really powerful. The way where we name things actually gives them context for people.
Basically, language shapes how we practice clinically. So, the language that we use to talk about sexuality in intellectually disabled people shapes how we actually think of them and how we present ourselves to them when we're practicing with them or with their families. So, the words we learn as clinicians, they're not just words. They're also like frameworks.
Yes.
So like if we use words like, one of the words you hear a lot with respect to intellectual disabilities is like the word independence.
Mm-hmm.
So I mean that's something that seems like a very neutral, innocuous word, but in actuality a lot of the time it devalues people who depend on others.
That's true. It implies a lacking if you don't, if you can't have that. You use the example of independence. What are some other examples where language is shaping how people see whether they're sexual or powerful and embodied or not?
So there, one that I use a lot in when I talk about issues like these is it's actually the word issues and a related word problems. Like I'll give you an example from from my job now. I work in inpatient psych at Methodist Hospital in Brooklyn.
Oh, wow.
And I was reading a treatment plan the other day for a trans client,
Mm-hmm.
and it said that this patient who was inpatient. I don't even remember what the presenting problem was, but this person had what was described on the treatment plan as gender identity issues, and you see that a lot actually more often in respect to people who are marginalized than to people who aren't. You see that in intellectually disabled people. A lot of the time you'll see somebody saying or writing in a report, this person has sexuality issues, gender identity problems, and basically it makes their sexuality or their sexual expression, their gender expression, into a problem. Now, of course, intellectually disabled people absolutely can have problems. They might identify them themselves. They might identify their gender identity or their sexuality. They might identify points of that or aspects of their lives as problems. But the problem comes when we as clinicians define those as problems without actually asking them, do you see these fundamental aspects of yourself? Do you see the fact that you're gay or trans, or that you have questions about sexuality, or that you're expressing your sexuality? Do you actually see that as a problem? And in most cases, it actually isn't a problem. It's just like a question they have, or something they might be doing that, maybe doesn't, fit in with the rest of society. It's not inherently something negative. So we have to be really careful when we imply these value judgments as clinicians.
Now, why did you choose Woodhull as one of your venues for sharing about this?
I mean, it seemed like one of the more progressive venues for these things. I mean, I'm getting emails about like sex toys and stuff. It's just, I feel like it's a place, the speakers are coming from a place of like openness and, lack of judgment. I mean, this, one of the things that you get when you talk about intellectually disabled sexuality, you just get kind of this visceral reaction from people sometimes.
Yeah.
If you're not in a setting where there's that sense of openness, it's like, wait a minute, what are you doing? Are you hurting these people? It's just this very, like I said, it comes from a place of compassion, but the compassion, can sometimes be misplaced. We have to come from a place of both compassion and knowledge.
And like you said, the risk assessment, how much understanding is being put into the decisions that are being made.
Right. Blind compassion does nothing. We need informed compassion.
Yeah. If someone, I think Woodhull, it's one of the warmest, most intellectually stimulating events that I go to each year. So I'm so glad you're going to be talking at it. If people wanted to find more resources about this, I think it's such an important topic. They can go to your website. Is there any place else you'd recommend?
Yeah, so I do have a book that just came out in April from Routledge. It's called Sexuality and Intellectual Disabilities, a Guide for Professionals,
Wow.
and the link is on my website. So it's a very concise guide. It's not just meant for clinical professionals. It's also for paraprofessionals, special ed teachers, just anybody kind of in that sphere. So
That's
it's a very
fabulous.
multidisciplinary book. You can, lay people can even like parents, consumers, just, it's a very brief, easy to understand overview of some of these issues.
Oh, that's fabulous. Thank you so much for creating it. I look forward to seeing you at Woodhull. And if you're listening to this and you have questions or comments, please leave them below and we'll try to get back to you. Thank you so much, Andrew.
All right, thank you.